Hey everyone, I'm Danielle Denise and I'm here to tell you everything you need to know before going into nursing school clinical during Corona. After being plucked away from the clinical setting last semester, I am back in it and I just want to share with you guys that things have changed. I'm currently wrapping up my third semester and I'm completing 2 rotations at 2 completely different hospitals. And I've been keeping my ear out just to kind of get a feel for how other people's clinical rotations are going at other hospitals, just to pick out some general ideas as to what you might expect going into the clinical setting this semester. So first things first, only take to clinical what you need, like lunch money if you're gonna eat at the cafeteria, your own lunch in like a small bag, and like your regular things like a stethoscope, extra paper, pens, and your pen light, and what's that thing called? I have a clipboard, but like you don't need a bunch of excessive stuff. You're not even gonna have all of that on you. Only pack what you need for the day, like really minimal things. Like you're gonna try to get in what you can get in, like you're gonna be focusing more on skills when they pop up. It might be a little bit boring because hospitals are having a low census, so don't take a lot of things, only bring what you need. You're gonna have like a small space to put your things, and yeah, keep it minimal. Next, going into the hospital, you're gonna be screened, and it kind of reminds me of this video where this guy is like patting people down to get into like a bar or club or something, and he's like hardly patting anyone down. That is literally what it feels like being asked the questions going into the hospital. I mean, of course they can't like give you a COVID test like right there. So they're just gonna probably take your temperature or not. One of the hospitals I've seen has not taken temperatures, but they tend to ask you the same questions. Have you been exposed? Have you been tested? Have you tested positive? And do you have any symptoms? So with that, I just wanna say be safe for you and your patients so that you can continue to go on this clinical experience, because it's a lot of students who need hours. There are schools who have completely stopped this, like their semesters, like because they can't get the hours, they just halted the semesters. So really take care of yourself so that you can keep getting into the hospital. As far as COVID rooms and COVID patients and COVID floors, hospitals are pretty much not allowing students on these floors. It might be different elsewhere, but for most of the hospitals I've seen and the hospitals that I went to, we are not allowed on those floors. Even for my next semester, we're expecting not to be allowed onto ICU floors or even ER floors. So as far as like COVID floors, some hospitals have designated complete floors as COVID units. So you will probably not get to go there. So don't worry about that, but just, still be safe. People travel out the hospital in and out. And as far as seeing COVID patients who aren't on the COVID floor, like in an extremely acute stage of the virus, you might encounter patients who are asymptomatic, and they try not to put you in those patients' rooms because they're trying to preserve PPE, as well as any other but isolation rooms. They won't let you in those either because they're trying to preserve PPE. Something else I want to add is that if you do come across a patient who is waiting on their results to come back, if you do go in their room and they come back positive, the hospital tries to keep track of who's been exposed to that patient, and they will contact you. But it is your choice whether or not you want to go in that room or not. I just want to say that it has been different. Like for me personally, the 2 hospitals that I went to this semester were like opposite ends of the spectrum. One is really trying to conserve their resources and are pretty much on a budget. And the other one is just like, it's almost like normal, like pre-corona. What I will say is bring your own PPE as backup. Like bring your own mask, bring your own N95. 1, because you haven't been fitted for an N95. 2, because in my OB rotation, we couldn't stand close to the mother. It really helped with labor as she's like actively pushing if we did not have our N95s. If not, we can still be in the room. We just have to stand way back by my refrigerator. I mean back. In fact, you could be out of my home. You gotta be far back. So bring one just in case. As far as like gloves and like regular like standard, PPE, One hospital had gloves in the rooms just as I'm used to, and the other kept the gloves at the nursing station, and you had to pack some gloves in a little Ziploc and take those with you for the day, and if you needed to replenish, you go back to the nurse's station. Now that might not be just conserving it from students, it's mostly like, you know, patients who come in and they figure, oh, I can't find any gloves anywhere, like at the stores, I'm just gonna take a box from the hospital. So they're really trying to conserve this PPE. It's real. Those are the major changes, like the key points. Lastly, I just wanna add, like, these rotations might be really hard to get. So when you come across an opportunity and you know that you might be safe, you know, take advantage of it, go for it. And just know, like, if you can't get a rotation, or if something's like shaky and you're like pressuring your staff and faculty to let you know what your rotation is, let me tell you, it has been pretty hard for them to find rotations, especially if they don't already have contracts with these hospitals. So just be patient with them, give them time. It'll come and they'll let you know. Like I said earlier, some schools have completely stopped, like they've halted their semesters. In the MSN portion, this has been like things before, like even before Corona, but now that Miss Rona is here, that like the MSN students really have to find their own preceptors and their own clinical rotations. For us in the undergraduate level, technically that's where I am right now in my program, they have to find clinical rotations for us. So please be patient with them, you know, don't be like rude and like pressuring them. They're doing their best to keep your program running and keeping your semesters going, because a lot of schools are backed up on hours, they're behind on hours. The board has like cut down on the hours required. So just be flexible, you know, you're gonna have to do that anyway. Some alternatives to being in the hospital setting are going to be your case studies, your virtual simulations, skills labs, but outside of the hospital setting, it's different. It's not the same experience. You don't get to experience like prioritizing patients and things that you need to do. You don't get like skills on real people. You don't get that interaction. Also, let me just throw this in now, that interaction with your patients is very different. You have that mask on, sometimes you have on a shield, goggles, all sorts of stuff, and it's just like, people can't see me smile. How will they know that I'm actually nice? Just like let your patients know that you're there for them, keep up high energy, try your best, and yeah, it's different. It's different thanks to Miss Corona. Okay, you guys, so that pretty much wraps up the pertinent info that I feel like you guys need to know. If there's anything that comes up, I'll probably leave it down in the comments section, or if any other nursing students have any other experiences that they want to share, feel free to leave that down in the comments as well. Oh, and before I head out, let me tell you guys about the giveaway that I just ran. As you guys might have seen in my last video, the giveaway went so smoothly, it went so well. I'm so glad at how well it turned out, and I messaged and emailed my giveaway winner this morning. They responded super fast, and I got the package out today, like less than 2 hours after speaking with them and getting their address. It went great. I am very pleased with that. So I would love to continue doing giveaways with you guys, and I might just start slipping them in videos here and there. And I told you guys in the comments that I wish that I could like break a piece and throw it to everyone, because I can't buy everyone a stethoscope, but it went really well and I really want to do that again. So make sure that you're subscribed and that you have that notification bell turned on and that you're interacting with me so that I see your wonderful faces and names and comments all the time, and we can keep those giveaways rolling. All right, so that's all that I have for you guys. Good luck in these upcoming clinicals, you guys. It's different, but we got this. We're rolling with the punches. We're gonna be the most flexible nurses. Like, what other nurses do you know that went through a pandemic during school? I'll wait. Okay, probably the swine flu one, but nothing like this. Nothing like, you know, we are going to be some of the most flexible nurses. Like, you guys, we got this. Let's keep going. Let's keep our heads up. We got this. Let's do this. I will see you guys in my next uploads or in my comments down below, and I'll see you next time. Bye.